I'm Anita Nurse, and welcome back to your daily healthcare news. In this segment, we will be discussing a topic that has been heavily weighing on nurses across the country. Today, we have a special guest joining us. Here's RPN Zehr. Hi, Zach.
Hi, Anita.
Thank you so much for joining us.
And thank you for having me, and thank you for featuring me on the daily healthcare news. This topic has directly affected me in my nursing career, that topic being staffing shortages.
I bet it has. I am very interested to hear. Can we start by providing the viewers with some background information on you?
Absolutely, I can. I'm a registered practical nurse working in Kitchener, Ontario at Green River Hospital. I've been a nurse there now for over 3 years and have been working full-time throughout the heat of the pandemic. Recently, I have started my studies to become a registered nurse. I absolutely love my job, but COVID and the pandemic has had a huge impact on how nursing is today, especially our staffing situations.
Zach, I can't even begin to imagine what nurses are going through. Let's start with what you mentioned and what has been widely talked about, staffing shortages.
Staffing shortages is an issue that has touched all hospitals, doctors' offices, nursing homes, and community care in one way or another. I did some research on the issue and came across some interesting points. 98% of healthcare facilities stated that they are short-staffed during the pandemic, and I can tell you that I personally felt this.
Wow, that statistic is extremely high. Zach, why do you think this is?
There are multiple contributing factors to that statistic, Anita. Firstly, I believe that the massive factor contributing to this issue is the lack of medical supplies. More than 20% of healthcare facilities have stated that they are short PPE or personal protective equipment during the pandemic.
But how do you think that contributes to the lack of staff?
Think about employees in any career. No one wants to put themselves at risk or endanger their health. For example, what if in construction, the workers were not supplied with hard hats on site? Would they see a decline in staff due to concern for their safety?
I can definitely see what you're saying there.
Another contributing factor for staffing shortages is nursing burnout.
Nursing burnout. Let's talk more about that.
Well, Anita, throughout the crisis, more people were increasingly admitted to critical care units, and nurses found themselves experiencing more stress and fatigue. In critical care units where patient death is common, death can be perceived as a failure, and it adds another source of stress and burnout for nurses.
That is an extremely high level of stress. I can surely understand that this would affect staffing.
Another key point in staffing shortages is that the nurse-to-patient ratio have increased substantially where I work, and that's no different across the country. Nurses have been forced to take on more patients with no additional supports. Research says that each additional patient that is added to a nurse's workload increases the patient's odds of dying by 7%.
Wow, that is terrifying. For patients, for families, and for nurses, I can't imagine how heavily this is weighing on nurses. That statistic is very concerning.
You're right, Anita. It is concerning. Nurses have been asked to work harder by increasing patient ratios while putting their nursing license at risk for no extra financial compensation, and that's a tough pill to swallow. No pun intended. Research says that 60.1% of recruitment staff believe that their salary is unreasonable for current workloads, and I truly believe that this is a major factor influencing staffing shortages.
I have heard that, Zach, and it's very upsetting. We have a nurse on an upcoming segment that will be talking about Bill 124 and nursing wages. Tell me, Zach, have there been any policy changes made to solve this issue?
Absolutely, Anita. A massive policy change that was made to help staffing shortages is the mandatory vaccine of nursing staff. I read online that urgently mandating COVID-19 vaccines for healthcare workers is both necessary and legal to decrease the potential spread of the disease.
Zach, how was this policy change accepted within the hospital setting?
To be honest with you, Anita, at first some people seem frustrated with this policy change. Personally, I believe that nurses need to promote the best practice. Vaccines are created and proven to help stop the spread of infectious diseases, so why should the COVID vaccine be any different?
So what I'm gathering is that the more people that get their vaccine, the less chance that there is for diseases to spread within the hospital, and that means less staff will be off sick?
Exactly.
Well, Zach, I appreciate your insight today. Our time is just about out. Do you have any closing statements you'd like to make?
I guess what I would like to say is that nursing is an extremely rewarding career, but staffing shortages is currently a major issue in the profession today. If nurses were better protected with PPE, the nurse-to-patient workload wasn't so heavy, and nurses saw better financial compensation, I don't think the issues would be as significant as it is. I urgently promote our policy change to receive the vaccine to everyone, as it truly does affect the staffing shortages. Remember, we're all in this together, and it all starts with you doing your part at home.
Well said, Zach. Thank you for your time today, and thanks to all of our viewers for joining us on the Daily Healthcare News. I'm Anita Nurse. Back to you, Jim, for the weather.